Across the globe, health officials are closely monitoring a recent outbreak of Human Metapneumovirus, or HMPV, in China. This virus, although not new to the medical community, has recently shown a concerning increase in transmission rates, prompting a heightened state of alert among global health organizations. While this virus is not new, its rapid spread serves as a stark reminder of the vulnerability we face from emerging infectious diseases. The HMPV, which primarily affects the respiratory system, can lead to severe complications, especially in vulnerable populations such as young children, the elderly, and those with pre-existing health conditions. Initial reports indicate a surge in cases, particularly impacting young children and older adults. Hospitals are seeing an influx of patients presenting with symptoms ranging from mild respiratory distress to severe pneumonia. This surge is putting a strain on healthcare systems already stretched thin by the ongoing challenges of the global pandemic. This development underscores the importance of understanding HMPV, its modes of transmission, and the steps we can take to protect ourselves and our loved ones. The virus spreads through respiratory droplets, making it crucial to practice good hygiene such as regular hand washing and wearing masks in crowded places. As we navigate this evolving situation, it is crucial to rely on credible sources of information and to remain calm. Misinformation can lead to unnecessary panic and hinder effective response efforts. Staying informed through trusted health organizations and following their guidelines can help mitigate the spread of the virus. The global health community has learned invaluable lessons from recent outbreaks, and these experiences are proving essential in guiding our response to HMPV. Research and data from past viral outbreaks are being utilized to develop strategies for containment and treatment, ensuring a more coordinated and effective response. While the outbreak is concentrated in China, the interconnected nature of our world means that the virus has the potential to spread beyond its borders. International travel and trade can facilitate the rapid spread of infectious diseases, making it imperative for countries to work together in monitoring and controlling the outbreak. This is why international collaboration and communication are paramount in containing the outbreak and mitigating its impact. Health officials from around the world are sharing information, resources, and expertise to develop a unified approach to combat the virus. In the following sections, we will delve deeper into the characteristics of HMPV, exploring its similarities to other respiratory viruses, available treatment options, and preventative measures that individuals can adopt to minimize their risk. Understanding the virus's behavior and how it compares to other known pathogens will be crucial in developing effective treatments and vaccines. Human Metapneumovirus, commonly known as HMPV, is a respiratory virus that was first identified in 2001. This discovery was a significant milestone in the field of virology as it added to the growing list of pathogens known to affect the human respiratory system. Despite its relatively recent discovery, research suggests that HMPV has been circulating in human populations for decades, often mistaken for other respiratory illnesses. Historical data and retrospective studies have shown that many cases previously attributed to other viruses were likely caused by HMPV. Like its viral cousins, the common cold and the flu, HMPV spreads through respiratory droplets expelled when an infected person coughs or sneezes. These droplets can travel through the air and land on surfaces, making it easy for the virus to spread in crowded or enclosed spaces. These microscopic droplets can linger in the air, potentially infecting individuals who inhale them or come into contact with contaminated surfaces. The virus can survive on surfaces for several hours, increasing the risk of transmission through touch. HMPV is highly contagious, and infections are most common during the winter and spring months. During these seasons, people tend to spend more time indoors, which facilitates the spread of respiratory viruses like HMPV. Young children, older adults, and individuals with weakened immune systems are particularly susceptible to developing severe complications from HMPV infection. These groups are at higher risk for hospitalization and may require intensive medical care. While many people infected with HMPV experience mild cold-like symptoms, the virus can lead to more serious respiratory illnesses such as bronchiolitis and pneumonia, especially in vulnerable populations. Severe cases can result in difficulty breathing and may necessitate the use of ventilators. Understanding the factors that contribute to the spread of HMPV is crucial in implementing effective public health measures to control outbreaks and minimize the burden of disease. Public health strategies include promoting good hygiene practices, encouraging vaccination, and monitoring virus activity. In the next section, we will compare HMPV to another respiratory virus that has recently captured global attention, COVID-19. By examining the similarities and differences between these viruses, we can better prepare for and respond to future outbreaks. By drawing parallels between these two viruses, we can gain a deeper understanding of their shared characteristics and the challenges they pose to global health. This comparison will also highlight the importance of ongoing research and international collaboration in combating respiratory viruses. While HMPV and COVID-19 are distinct viruses, they share some striking similarities. Both viruses have been the subject of intense study and scrutiny by the global medical community, as understanding their behavior is crucial for public health. Both viruses primarily target the respiratory system, causing a range of symptoms from mild to severe. These symptoms can include coughing, shortness of breath, and in more severe cases, pneumonia and acute respiratory distress syndrome. The modes of transmission are also remarkably alike, with both viruses spreading through respiratory droplets released during coughing, sneezing, or even talking. This similarity in transmission pathways has significant implications for how we manage and mitigate the spread of these viruses. This resemblance in transmission underscores the importance of preventative measures such as mask wearing, hand hygiene, and social distancing, which proved effective in reducing the spread of COVID-19. These measures are equally important in controlling the spread of HMPV, as they help to minimize the risk of transmission in public spaces. Another shared characteristic is the potential for a symptomatic spread. This means that individuals who do not show any symptoms can still carry and transmit the virus to others, making it more challenging to identify and isolate cases. Individuals infected with either virus may be contagious even without displaying any symptoms, unknowingly transmitting the virus to others. This silent spread can lead to larger outbreaks if not properly managed through testing and contact tracing. This highlights the importance of widespread testing and contact tracing in controlling outbreaks. By identifying and isolating infected individuals, health authorities can break the chain of transmission and prevent further spread. However, there are also key differences between the two viruses. Understanding these differences is essential for developing targeted treatment and prevention strategies. COVID-19, particularly in its early variants, demonstrated a higher transmission rate and a greater potential for severe illness, especially among unvaccinated individuals. This higher transmission rate led to rapid global spread and significant strain on healthcare systems. Additionally, the development of vaccines and antiviral treatments for COVID-19 has significantly impacted the course of the pandemic, offering a level of protection and treatment options not yet available for HMPV. Vaccination campaigns have been crucial in reducing the severity and spread of COVID-19. Understanding the nuances of these viruses, both their similarities and differences, is crucial in developing targeted public health responses and in effectively communicating risks and preventative measures to the public. Public education and clear communication from health officials can help ensure that communities are well informed and prepared to take necessary precautions. Human Metapneumovirus, or HMPV, can manifest in a variety of ways, with symptoms often mimicking those of the common cold or flu. In many cases, particularly among healthy adults, HMPV infection may cause only mild discomfort, easily mistaken for a passing cold. However, it's essential to be aware of the range of symptoms that HMPV can produce, as early recognition is crucial for seeking appropriate medical care and preventing the spread of the virus. Common symptoms of HMPV include runny nose, cough, sore throat, and fever. These symptoms typically appear within a week of exposure to the virus and can persist for 1 to 2 weeks. In some individuals, particularly young children, older adults, and those with underlying health conditions, HMPV can lead to more severe respiratory complications. These complications may include bronchiolitis, an inflammation of the small airways in the lungs, characterized by wheezing, shortness of breath, and difficulty feeding in infants. Pneumonia, an infection of the lungs, is another serious complication that can arise from HMPV, causing chest pain, high fever, and difficulty breathing. If you or someone you know experiences any of these severe symptoms, seeking immediate medical attention is paramount.